Okay, I think I'm going to go ahead and get us going so that we can keep everything on time here, but welcome. I'm Laura Ellsworth, the Strategic Partnerships and Advocacy Manager at Council for the Homeless, and my pronouns are she, her, hers. And I'm excited that you all could join us to hear about yet another historic legislative session for affordable housing and homelessness this year. Together with partners and advocates, policy was passed that better paves the way for affordable housing and renter protections and investments into funding for affordable housing and homelessness. I'm also extremely happy to have Senator Annette Cleveland and Representatives Monica Stonier and Paul Harris with us tonight, as well as board member Cheryl Pfaff. They're here tonight to share with us their thoughts on the legislative session and the role of advocacy at Council for the Homeless. So just a bit of housekeeping to get us started as always. The only people that you'll see in here tonight are the panelists and myself. The webinar is going to be recorded and shared out afterwards on our website. We'll get that sent or posted within the next week. And we'll also send it out to anyone who attended tonight and anyone who may have missed it. And also there will be a survey that'll pop up right at the end of the webinar. If you can, please do fill that out. It's just 2 questions, but it helps us keep track of how we're doing and also helps us determine future webinar topics. So here's a quick rundown of our agenda for tonight. I'm going to review the legislative priorities for housing and homelessness that we had going into the session, what actually passed, and why advocacy is crucial to the work we do at Council for the Homeless. We'll hear directly from Representatives Monica Stonier, Paul Harris, and Senator Annette Cleveland. And if we have time, we'll do a little Q&A at the end. And as always, we'll end our webinar with a call to action. So first, I just want to get started with a brief setting of the stage for the 2022 legislative session. So the state legislature not only passes laws each session, but they also produce a budget that the state follows every 2 years. And 2022 is the second year of the current 2-year budget biennium. So because doing the budget takes a lot of time, the legislature alternates between a long session, which is 105 days in the first year of a biennium, which was 2021, and the odd number, it's the odd numbered years actually, and then meets for a shorter 60-day session in the second year, the even numbered years, which is also when they make adjustments and necessary fixes based on the latest revenue forecasts. So in addition to focusing on the budget every year, the legislature passes laws and makes statewide policy. And, you know, in long session years, there's more time to hear and pass laws than there is during short session years. So 2022 was really unique in that there was a very large budget surplus going into the session when many times there was a deficit to contend with. And now there's room for hearty debate about what to do with an unprecedentedly large budget surplus, but when contending with an also unprecedented global pandemic and just the torrential level of need for financial support, our legislature as a whole chose to make some historic investments into the affordable housing and homelessness crisis. And if there's anything that the pandemic has exposed, it's that housing is a public health issue, a healthcare issue, and that a loss of income greatly influences housing security. So as the legislature convened in January, there were some significant housing and homelessness goals for our advocacy work. And COVID continued to loom very large when we actually had the biggest surge of the pandemic with the Omicron variant just a few weeks after the legislature convened. Best laid plans. So, as I mentioned, we had some really ambitious goals this year, and here are a few key budget priorities that we had going into the session. This may look familiar to those of you who have advocated on behalf of Council for the Homeless and the Washington Low-Income Housing Alliance this year. Council for the Homeless works in partnership with the Washington Low-Income Housing Alliance to advocate for housing and homelessness funding and policies that help prevent homelessness and preserve affordable housing. So we know that we have a huge housing shortage in our state, and we have a crisis on our hands when it comes to affordable places for people to live. So we ask for a total investment of $500 million for affordable homes through an investment of $430 million for the Housing Trust Fund and $70 million for rapid acquisition of housing and shelter, which funds projects like Bertha's Place here in Vancouver, which is the new shelter that opened up recently that used to be the Howard Johnson over by the Vancouver Mall. So this added crucial shelter for people over 55, single women, and couples without children. We also asked for a significant increase to the ABD cash grant program. This is a program that provides a small amount of assistance to folks while they file for their SSI or SSDI, and that process can take many, many months. And people applying for this are disabled, and 43% are experiencing homelessness. We also asked for funding to help with frontline workforce capacity stabilization for homeless service providers. As you know, frontline workers in many fields have been challenged throughout COVID in so many ways, and homeless service providers are included in that. They've been out on the front lines, taking on more personal risk and persevering throughout to serve the most vulnerable people in our community. So it's my extreme pleasure to let you all know tonight that these funding priorities were all accomplished to varying degrees due to incredible efforts from housing and homelessness advocates and courageous legislators. Here is a rundown. So we asked for 500 million for affordable homes and got more than 440 million. And this includes 114 million for the Housing Trust Fund, 240 million for rapid housing acquisition, 60 million for the new Apple Health and Homes program, which we'll talk a little bit more about in just a minute, 15 million for homeless youth facilities, 2 million for manufactured housing preservation, and 9 million for affordable housing development utility connections. Additionally, in the operating budget, so those things were all capacity building funding allocations in the capital budget. And now we go to the operating budget, which funds social services. So this includes 2 million for pre-eviction civil legal aid, 68.5 million for rental assistance, more rental assistance, and we'll talk more about that later. 4.5 million for foreclosure prevention, and 45 million for services to help transition people experiencing unsheltered homelessness into affordable housing. And funding to permanently increase the age blind and disabled cash grant program from 197 to 417 per month. So last but definitely not least, the legislature allocated 55 million for frontline homeless service providers. And this will provide a much needed cash infusion for people who themselves are facing housing insecurity, all the while trying to help others gain stability. As you can see, I kind of ran out of room on this slide because there's so much more I could have put in here, but this just gives you an idea. And again, usually in a supplemental budget year like this one, there isn't much opportunity to allocate new funds to housing and homelessness priorities. But this year, because of the leftover federal COVID funds and the economy's unexpectedly rapid recovery, Washington State had funds to spare. And we're so happy that the House and the Senate took advantage of this rare opportunity to demonstrate a commitment to making affordable housing and homelessness related programs one of their biggest budget priorities. This year, we got almost everything that we advocated for in the budget. So yeah, there's my so much more graphic. And altogether, the new investments finalized in the budget were well over 669 million, and the total 2-year capital investment for building or acquiring affordable homes and shelter was over 734 million, which is just phenomenal. So we also advocated for policy in this short session. and which is, really intense and happens really quickly. This year, the REIT tax exemption bill was passed. It actually was passed in 2020, but then had to be vetoed by the governor right when COVID hit, just as the legislative session adjourned that year. And he didn't cut it because he didn't like it, or thought it was a bad bill. It was really just to save and prepare for a potentially huge hit to the budget. But this incentivizes sales to affordable housing providers and gives them a leg up when competing for increasingly scarce land for multifamily housing. We also advocated for a rental payment option that allows tenants to pay rent using other options besides an online portal that charges significant fees. I want to say this one, well, spoiler alert, this one passed with strong bipartisan support. I think it was almost unanimous in both chambers, which is fantastic. We also, thanks to Senator Cleveland, we advocated for this IdentiCard program, and it was introduced and sponsored and championed by Senator Cleveland that creates a way for people experiencing homelessness who lose their driver's license to get a new one at no cost to the DMV. This, removes a lot of just really frustrating barriers for folks, as you can imagine, not having an ID would do. The Apple Health and Homes program was something that we advocated for this year, and it will increase and streamline permanent supportive housing and pairing it with health services, going back to what we were saying earlier about healthcare and housing being so linked. We also have House Bill 1904, which would have required landlords to give tenants 6 months notice for significant rent increases, and would have allowed a tenant to terminate their lease free of charge if they couldn't afford to stay. Another really important bill that we advocated for that was informed by service providers from across the state. We also had House Bill 2017, known as the Housing Justice Act. This would have shielded formerly incarcerated Washingtonians and their family members from housing discrimination based solely on criminal record. And then lastly, our priority this year was House Bill 2023, which would have created a streamlined process for tenants to enforce their rights in court in response to negligent or abusive landlords. So while not everything we advocated for passed, here's what did. And of all these new policies and programs will remove barriers, they will help stabilize people, and they will create pathways for people to remain in their homes longer or help their time experiencing homelessness become shorter. So overall, I just can't emphasize enough how huge a magnitude of victory this is. This is what a serious commitment to housing justice looks like. These funds will make a huge difference in providing and securing affordable homes for thousands of people in Washington. And I want to thank the lawmakers who worked hard to support such bold investments. Meanwhile, over 2,000 advocacy actions across Washington were taken over the last 60 days. Many of you are here tonight who helped with this effort. And this is a record number of people taking action during a short legislative session. So to all our advocates, all of our resident action project members, and all of our staff, these investments are because of your hard work and a demonstration of the power of advocacy and organizing. And there's always more to do. So unfortunately, these are the bills that didn't make it this session. And these were all critical to our mission of preventing and ending homelessness in Clark County, and we will keep advocating. We believe that the rights these bills would have protected are basic, uncontroversial, and benefit everyone when vulnerable people have rights in place that help them remain stable. When everyone has a safe, stable place to call home, we all benefit. So while we're disappointed that these weren't made into law this year, we will keep listening to the needs of Washingtonians and Clark County residents, and we will keep trying. So let's talk about what all of this means for Clark County specifically. We know this is a tremendous investment for the state, but what does that look like here? There's been an unprecedented infusion of resources for affordable housing and homelessness in the most recent legislative sessions. And this has resulted in more prevention, more emergency shelter, and more affordable housing. So regarding prevention, or what we call rental assistance, more than 2/3 of people who entered into the homeless system in 2020 were newly homeless and had not touched the homeless crisis response system in at least the last 20 years. So I do want to mention that the state investments that we've talked about tonight are working in conjunction with federal investments like the Federal CARES Act dollars and emergency rental assistance and Treasury rental assistance, which come from the state. This has allowed the entire homeless crisis response system to facilitate a lot more prevention services than ever before. In fact, more than 5,200 households received rent assistance here in Clark County since August of 2020. And even though the waiting list for rental assistance, you know, it opens up periodically, and when it does open up, it usually fills up within 30 minutes. And then we shut it and then work through the list and then open it up again. And our staff in this community at all the agencies providing this service have just been working incredibly hard on getting this funding out the door into the hands of people who need it. So it illustrates, while we've had this unprecedented amount of funding, we also have this unprecedented amount of need. And, unprecedented seems to be the word of the last couple of years, unfortunately. So in regards to emergency shelter, in addition to what you see here, which are some of our emergency shelters in Vancouver, many of you, we talked about Bertha's Place. We also have Bertha's 2, which is operating out of the former Elahan Place. And combined, these two offer 94 beds that will be prioritized for seniors, single women, and couples without children. They both recently opened this last winter. And after Bertha's Place serves as an emergency shelter for 2 to 3 years, it will be converted into permanent supportive housing. So remember that $240 million investment made by the legislature for rapid shelter acquisition and housing acquisition? Well, this is a perfect example of both, and we can expect more of this to come. In regards to tenant protections, with the new laws in effect, we can expect a shift towards equity for people who are very low income and who are navigating an eviction process. We can expect less retaliatory evictions, which disproportionately affect women-headed households, people of color, and members of the LGBTQ community. It's going to take some time to put the pieces into place to allow these protections to truly take effect. But thanks to our advocates and our legislators, the foundation really has been laid for this. No pun intended. In regards to investments made into permanent supportive housing, I want to show you a local example of what that looks like here in Vancouver. So thanks to the investments made by our legislature, we do have more of this to come. This is just a couple examples of what's opened recently, but more projects like the Elwood and the Pacific, will be, coming down the pike in the near future, which is exciting. So now I'd like to introduce you to Cheryl Pfaff, our Council for the Homeless board member, supporter, and an invaluable Faith Community severe weather shelter partner. Cheryl has been involved with Council for the Homeless since 1989, when our agency was first formed, and has seen our advocacy presence evolve, grow, ebb, flow during that time. And she's going to just share some of her thoughts about the effects of housing and homelessness advocacy has had in our community. So Cheryl, I'll turn it over to you.
Thank you, Laura. Council for the Homeless has been involved in advocacy since its beginning in the early 1990s. Actually, the document that created us as an organization specifically states that one of our core functions is advocacy. Today, the word is part of our tagline and a big part of our ongoing work. I'm just going to share a little bit about what we do, but most of you are probably already involved in it, so thank you. A major part of our work is keeping the community members informed and maintaining contact with elected officials. We bring information about best practice solutions. We provide data regarding needs and share stories of neighbors who are looking for our support and whom we are able to serve. We really value the lasting partnerships that we have with the community. We could not do this work without you and with the wonderful support that we get from our policymakers. The council regularly coordinates the Legislative Action Day that many of you may have participated in, and encourages participation in other public events where voices are needed to be heard and to speak for those who might not be able to speak for themselves. Laura creates an amazing array of emails that provide information links to policymakers and calls to action, which support many of the things that she has just talked about today. If you are not on that email distribution list, please go to the Council for the Homeless website and click yes to be on the email distribution list that Laura has created. It's a great way to stay informed about all the things that are going on. Our board and staff are really proud of this work, and we appreciate those who work with us. Specific thanks I want to give to Clark County, City of Vancouver, and other city in the county officials. Special thanks to all of you for being here tonight, and to our legislators who work tirelessly on behalf of our community and the people we serve. We could not do this work without you. You've heard a lot from Laura about the specifics of what will be going on in the community. The council will be involved in making some of that happen. Many other organizations who are our partners will be doing that alongside us, and we'll be continuing this advocacy work as we move into the future. Unfortunately, the work is never done. But again, thank you all for being here. Thank you for the work that you're doing. And I invite you to join the council in any of our advocacy activities if you are interested and able. And Laura, I'll turn it back to you.
All right, thank you so much, Cheryl. Appreciate that. And yeah, thanks to Beth for putting in the link to our advocacy work on our website as well. All right, well, so now enough hearing from me, and let's turn it over to our wonderful lawmakers who have so generously joined us tonight. I think Senator Cleveland, I'll go ahead and kick it off with you. And if you would just like to share your thoughts on the session and what it's been like to legislate during, you know, this unprecedented time that we've had the last couple of years, and, you know, kind of what funding and legislation do you have the highest hopes for in your vision for its impact here in Clark County?
Well, Laura, thank you. And thank you, Cheryl. It's such a pleasure to be able to join you tonight, talk a little bit about the past legislative session. For those who are participating, I'm your state senator, Annette Cleveland. I was elected in 2012. I'm the first woman from the 49th Legislative District to serve in the Senate. And I am very fortunate to sit on the Housing and Local Government Committee in the Senate, as well as the Transportation Committee, the Rules Committee, and I'm also chair of the Senate Health and Long-Term Care Committee. Rather large scope of work to focus on. This, as Laura said, was a short 60-day session, but in my mind, it was one of the most productive and successful sessions of the years that I've served in the legislature. And I just want to take a moment to thank Laura, thank Cheryl, thank the Council for the Homeless, and each and every one of you who are participating tonight in this webinar, and let you know that when I represent you in Olympia, I'm so very proud of our community. I'm proud of what a leader our community has been in addressing these really tough, difficult, complicated issues of affordable housing and homelessness. And as I know everyone on this call knows, the City of Vancouver passed an affordable housing fund in 2016 that has distributed some $30 million toward affordable housing projects and homelessness in our area and our community. But I believe that's due, that success is due in large part to the leadership and advocacy of you, Laura, Cheryl, Council for the Homeless. So I want to say thank you. I feel strongly that while we made very historic investments in this area of housing, affordable housing and homelessness, that Laura did a wonderful job of summarizing tonight, and we've made investments now for a number of years in a row, we also need to focus on a more coordinated approach. And again, our community is a leader in this, and I'm proud of that. But there's long been recognition, I think, of housing being one of the social determinants of health, but there hasn't been necessarily as much recognition of the need to better integrate housing and health. So that is the policy, in answer to your question, Laura, that I'm most excited about, that we passed this session. It's House Bill 1866 that Representative Chop was the prime sponsor of, and it is legislation that came through the Senate Health and Long-Term Care Committee that I chair, and legislation that I spent a great deal of time helping to advance this year, because I feel really strongly that bringing together housing and health, because housing is health, by beginning that integration of our healthcare authority, our Department of Commerce, our Department of Social and Health Services, and our local governments and community-based services, to really start to knit together even more closely than ever that seamless fabric of the safety net that is meant to help support both health, but also the social determinants of health, and being sure that we're addressing those as well, including housing, is exciting. And we're one of the first states in the country to take this step forward. So that is the policy that I'm very interested in continuing to focus on moving forward with the passage of this foundational legislation, but then also looking out into the future and working to identify what other policies we need to put in place to continue making progress. And in fact, I'm working now as chair of the Senate Health and Long-Term Care Committee on our interim committee plan, and the link between housing and health, and some of the work that we've seen done around the state in helping to establish better supportive housing that's linked to healthcare. We're going to be taking the tour to look more closely and in depth at some of those successful projects, and how it is that we can help ensure that those are being implemented in other areas of the state as well. So in addition to that, it's already been mentioned that I prime sponsored the IdentiCard bill, because I've heard over and over and over from many with lived experience and many who with expertise in some of the barriers that are faced to housing, that oftentimes it's a lack of identification that is one of the most basic barriers to being able to apply for a job, being able to get a bank account, being able to apply for housing. So I'm really pleased that we're finally able to pass that bill and have it funded in the transportation budget. And it's funded, I know that seems odd, but it's funded in the transportation budget because it's Department of Licensing that takes the lead in issuing those IdentiCards in collaboration with Department of Commerce. So there's so much work to do. And while I appreciate this opportunity tonight to kind of take a step back and look at the body of work that was accomplished this year, I'm looking ahead to the future, and I'm looking forward to your continued advocacy, so that I'm sure I'm focusing with my colleagues here tonight on those issues that are of most import to our community in particular. I'm always distinctly aware that we are unique and different in a lot of ways. We're not, solutions maybe that might fit one community aren't going to necessarily fit ours. And that's where I find the value of your advocacy most helpful, is helping to identify those things that for our community will make the biggest difference. So with that, I want to end with, well, I'll share maybe later how strongly I feel that housing is a human right. And I have a quote that I actually shared on the Senate floor this year that I would love to share with you later tonight. So I'll pause so that I can allow my colleagues to also share. But thank you again for having me tonight.
Thank you so much, Senator. And please don't let me forget to go back to you for that. Yes. All right. How about Representative Harris? I'll go to you next. And if you could just share your thoughts on the session and the investments and prioritization that you all made for housing and homelessness this year, and what your hopes are as we start to see the effects of it.
I rarely go before Monica. You sure you want to do that?
You know, it was a tough decision.
All right, all right. Well, everything that Senator Cleveland said is so true. I think the one thing that I think is really interesting was Bill 1866 by Speaker Chop. I think it was voted for that. As I thought about it, the impact of being homeless and what it does on your health is truly staggering. And so what Senator Cleveland said is so true. What I do look at homelessness and what's going on, I think that my big concern is there tends to be two things that most of these individuals have, and that would be a mental health issue or behavioral health issue and substance use abuse. And two areas that we actually, one that wasn't mentioned too much is we did put $100 million into behavioral health just between now and the end of the year. And then we put in a 7% increase into the behavioral health going forward. I think is quite important. And I think behavioral health will continue to be a very, very important issue. I sit on the appropriations, the healthcare committee, and I sit on the rules committee. Was not very successful this year getting bills through at all, in fact. Ran a couple bills, but I did learn how budget provisos work and was able to get a couple budget provisos, which actually I believe are important to people who might be on Medicaid. And one was looking at fluoride. I think one area that is going to be of extreme importance going forward is dental care for those who cannot afford it, and specifically those that are on Medicaid. We do not do a great job in our state of taking care of those individuals, and it'll be something that I'll be working on in the future. Short of that, it was just a great session. I really believe it was an impactful session for those that are on homelessness. I know, and I don't want to speak for Senator Cleveland, but I'll speak for myself. I have a homeless encampment right by my office. I've been pretty passionate on this issue of trying to help these individuals, and I will continue to be passionate on the issue. I know there's still more work that needs to be done. I visit that encampment quite often, to be quite frank. I know that there is mental illness there and substance use, and those are two issues that I will continue to work on. I serve on the board of Columbia River Mental Health, and I serve on the board of SHARE, two really important nonprofits in our area that have done great work. I was a proponent of Prop 1. I will continue to be. I will continue to be an advocate for the homeless individual. And I really appreciate this opportunity to be here tonight. And I hope we have a chance to get questions, because I'd love to hear what others think. So thank you very much.
Yeah, thank you. And that's so true about behavioral health investments, and definitely thank you for bringing that up, and dental care as well. Your dental health is so tied into your whole body health. It's unbelievable. I've learned that over the years, and it's definitely one of the most popular services that is provided for folks like at Project Homeless Connect and the different events we do. Unfortunately, this year we had snow on that day, and the dental van couldn't make it out of their driveway, but it was definitely a big priority. So yeah, thanks for bringing that up. Yeah.
And we can do more there. So I appreciate that.
Yeah, thank you. All right. Well, last but definitely not least, we have Representative Monica Stonier. Monica, if you don't mind taking it away from here. And yeah, thank you.
Sure, very happy to do that. Thanks for having the three of us here to answer questions that may arise, but also just to kind of share what we are most proud of in the close of this session. You all have mentioned things that, that certainly provide care, comfort, and hope in our community. And I'll touch on a couple of those only briefly, since my friends here have already covered a great deal of that. But first, I'll start by sharing, I'm a teacher from this community. I think this is my 23rd year in Evergreen Schools. And, teachers, especially at this time, returning from the pandemic, have seen the challenges that students face, either from the incredible increase of their folks trying to access housing resources, but also lack of behavioral health care that was mentioned before. So much of the work that you all do as advocates, you interface closely with our school system, because oftentimes that's where the closest touch to a family maybe, or at least the most frequent. So I want to thank you for that. Our school community knows of your work, and I just want to continue to encourage that connection. So that means I'm on the K-12 Education Committee in the House. I'm also a member of the Healthcare Committee and Appropriations Committee. I have served on the Capital Budget Committee in the past. Almost all of my time serving on committees has been alongside Representative Harris. We always joke about how we might need to diversify, but as it turns out, Representative Harris and I tend to be pretty good partners in the House for this community. So I really appreciate that. That collaboration. Paul, you mentioned you weren't all that successful in passage of bills this year, but you know, what this community should know about Representative Harris is that he's quite selective of the bills that he chooses to sponsor, and they're not easy lifts, and they make a huge difference, not just for this community, but for the people of the state. And historically, by watching Representative Harris's leadership, I have noticed that. So you can joke about the hit rate, I guess, but the quality of bills sponsored, I think, is second to none in his caucus. The bill mentioned the health, home, and the Apple Health and Homes bill from Representative Chop. I just want to, enough has been said about that. The only thing I'll add is I worked with Representative Chop along with Representative Riccelli from Spokane to ensure that that bill was one that would serve people statewide and not stay focused in the Puget Sound region, where a lot of those resources go. Representative Chop was very pleased to work with the two of us on ensuring that those resources made it outside of that central region and into places like Southwest Washington. So I appreciated his collaboration on that. A shout out to all of you who worked so hard to get resources and funding out to our community. We heard this last session from around the state how frustrated people were that the resources coming from the federal government and from the state government were struggling to make it to the people who needed it most. And guess who led the charge on doing that efficiently, doing it quickly, and doing it well? And that was Clark County. We were able to stand up in Olympia and say, do not take this as a lack of need or desire, but just know that this was a challenge that communities face to get that money out, because that is not, it's not like the influx of funding comes like all the time. But you all were a great demonstration of how it could be done. And I just want to thank you for that. We were also proud of our community and the hard work that you, whatever it was, whatever magic pixie dust you have that made that happen, we were quite appreciative of that. And I know that the people who benefited from that may never know your names or your work hours, but they certainly are better off today as a result. The one thing that the other thing that I'll mention is just where I'm hopeful. Representative Harris talked a little bit about, and Senator Cleveland as well, about the behavioral health challenges. We had a handful of bills that we passed that really worked to address housing in some of these highly impacted groups of people. For example, we expanded the landlord mitigation program to include people fleeing domestic violence, sexual assault, and unlawful harassment or stalking by others. So we want to make sure that those who are literally on the brink of a life and death encounter have access to resources that help keep them safe and their children safe in many cases. And additionally, House Bill 1905 reduces homelessness for those youth that are discharged from public systems of care. So imagine a foster youth or our LGBTQ youth who are often hard to place in homes or coming out of rehabilitation from the juvenile system. Without a home, these children were very difficult to discharge. And so there are additional resources that will go out to those children as a result, those unaccompanied youth. And then finally, another set of efforts to make sure that we intertwine the behavioral health, including mental health and substance abuse challenges for people that are discharged and have nowhere to go. That was House Bill 1860 by Representative Lauren Davis. So, I think what you heard maybe in the three of our comments is how incredibly important it is to stay focused on the integration of the services that come from the state level so that they truly do meet the outcome that we're all seeking to attain from the policy. We've done a lot of years of doing things in silos. And I think in the last couple of years, the coordination between the capital budget, the operating budget, and this year, the transportation budget has really demonstrated an effort for legislators to pay attention to how the resources actually get to real people. And so I'm hopeful that the next time we return to Olympia, we'll be able to take that up from where we've left the mantle and keep going. And with that, I'm looking at my notes and I think I covered all of my things. So I will stop and hope we can get to questions.
All right. Yes. Thank you all so much. And yeah, it feels like a lot of things have come together in the last couple of sessions, particularly around that coordination and recognition that, I mean, as we've talked about many times during our webinars, there's no one size fits all approach. And so integrating things and combining services and getting, all of those things working in concert with one another when it comes to both funding and law, policy that's passed is really crucial. And I'm hopeful that we'll start to see that affect, the impact of that in our community. So. All right, well, we do have some time for some Q&A, and bear with me because I'm sort of trying to monitor the chat myself here. So I'm going to kind of scroll back and look through, but please feel free to post any questions in the chat. And I did have a question a little while ago about the IdentiCard program. Amy asked if you lose your license and you get a new ID card, what if you have your license and your ID card? Like if you find it later, what would that mean? Would you need to surrender one over the other? Do you happen to have an answer for that, Senator Cleveland?
Yeah, I'm happy to share, and thank you for the question. The IdentiCards have been purposely designed so that they're not confused with an official driver's license. And so they are a distinct and different form of identification from a driver's license. And they can be issued, I believe, for up to a period of 8 years. I think that's how long they're valid. And then you can apply for a renewal of that IdentiCard if it expires after 8 years. So I hope that helps to clarify a little bit the difference.
Yeah, thank you. I'm seeing lots of thank yous coming up in the chat for all of you. So thank you for that. Let's see, we got a question. This one, I'll probably take this one. What is the means of communication for folks who are homeless to inform them of any opportunities? We do have another really exciting program that has come about with this increase in funding over the last few years is what we call coordinated outreach. And Council for the Homeless is the hub for that. And we have basically outreach workers, so teams of folks that go out into the community, go to the camps, talk to folks, start to build that trust with people. In the past, we've had representatives on, Jamie Spinelli from the city of Vancouver, who used to be an outreach worker for many years, mentioned that it can take, I think, 17 positive interactions on average to build trust, to get somebody connected to programs. So it's something that just takes authentic, real, slow human engagement that our society has a hard time with, especially when things are real in your face and real right now issues. But so we do have, a coordinated approach to that happening in our community at a level that has never been funded to that level before. And so it is the hope that, the messages are getting out there to the folks who need it, that the services are out there should they want to begin engaging. But it just takes time to build that trust, to get folks ready to engage. So hopefully that answered that question. And let's see, what else do I have here? Let's see. Okay, so clarifying question on the ID cards, I don't believe you need to surrender your license in order to get an ID card. The purpose of the ID card is if you were to lose your license or have it stolen, that you have another option to get a card that will afford you the same, I want to say clearances, but the same, access to many basic needs and services that our driver's licenses give us that we just sort of take for granted every day. So, okay, here's a question about what treatment looks like for those who are suffering addiction. Specifically, what is a considerable time frame for them to stay in treatment until they're healthy and strong enough to go back into the community? Yeah, it worrisome when we lose that trust that people don't have enough time to heal. I don't have the background enough in that to know how to answer that. I don't know if anybody else here does, but I'll open up the floor to see if anyone has anything to contribute to that answer.
Well, I'll start with a stab at it. I think, that's one of the major political questions that gets raised, I think, when it comes to this issue is, how much is enough or not enough leniency, and how much of, an addiction is a choice versus a disease or something that requires treatment, as all illnesses do. And so, that's not an uncommon question to debate, frankly. And so that's one thing I'll say is that we get that question a lot. In my opinion, the best response to that is handled by those who are on the medical treatment side of the issue, advising what a program should look like. And I think in addition, this past year, maybe the last 2 legislative sessions, we have seen a significant increase of adding people with lived experiences to boards, commissions, and policy advising groups. And I think that is making a difference as well. When you have people who are living in recovery and can talk about the challenges that their addiction has brought at times when they were on the right path. And as happens frequently with any addiction, there's a slip or a challenge. Getting back on track after having experienced some success and some improved quality of life is quite motivating. And losing sight of that is easy to do when we aren't working with people with those lived experiences. So similar to Laura, having not working in this space, in this policy space, I think the most fundamental question that I feel compelled to answer is whether or not I believe that in the same way that you may see a cancer or some other illness return, so does struggle with addiction, and that deserves the treatment that we know can be successful, and that is often long and slow as well.
Yeah, thank you. I know, and it's definitely not a linear process by any means as well, which makes it even all that much more challenging. So but everything in this work, nothing is a one size fits all approach. And yeah. All right.
And I feel like what's actually happening through Columbia River Mental Health, there's actually outreach now. They're actually going out into the streets and bringing people in and helping people. I see a lot more of that taking place. And I think what Monica was talking about, the mentoring now, where people who have had lived experiences come in and help others, I think is so important. And I think we've even created a kind of a licensure for these individuals that can come in now. And I think it's very helpful. The more people we can get to help these individuals, the better. I did notice something in the chat, and when it was about gambling, and I've never thought of gambling much. Is it a pretty significant issue for the homeless? Is that a significant issue?
I can't speak to that directly, yeses, but I see yes.
Okay.
Yeah.
Well, and that's interesting. One of the things I did get a budget proviso in was actually for smoking cessation, but it actually goes into also drug use and other things. And it'd be something I'd be very interested in to take a look and see if we can't get some more help for those people that are subjected and to have I guess, a propensity to gamble, would be to help them. So that will be something I would be more than interested to looking at. So thank you for that in the chat. It was something I hadn't thought of for a while.
And Laura, if I may, I would like to add that, the pandemic has really brought, I think, increased urgency to really focusing on those trusted community individuals that can reach out and connect with those who are in need of services. And I know that with the Department of Health, I've been exploring, some of those successes and how we can maybe broaden those efforts to, include a wider range of issues beyond the pandemic.
Yeah,
The other thing
thank
I
you.
have to share really quickly, because Representative Harris is just very humble, and something that he worked hard along with Representative Stonier and myself to accomplish for this community was to obtain money in the capital budget, $283,000, to address the need to update our winter overflow housing shelter. And so really pleased that we were able to secure those resources for this community specifically, and bring about a really, I think, necessary update to the shelter.
And on the ID cards, I noticed a little bit in the chat, we passed that. It takes a little while to get these programs implemented. They don't happen instantaneously. But another thing then, and Senator Cleveland didn't say much about this, and I think it's really important about the ID card, is it helps those people who are coming basically out of our jails and out of other institutions who might not have a driver's license, but can go and get an ID card and can get services. And I think that's really important, especially for those individuals who have been incarcerated, who have come out of a really difficult situation in their life. I think it's really important that they have an ID card.
Yes, absolutely. It's, it goes with that no wrong door approach. I know people can go through DSHS and get them, but this is just, again, one more place
Yep.
for people to go in the most probably offhanded first thought place, which is I go to the DMV, right? Like if I need an ID, that's where I go. I don't go to DSHS. So again, it's just removing another barrier for people to help them get the very necessary items for living, whether or not they're homeless. So like an ID. So. All right. Well, thank you everybody so much. I'm going to go back to my presentation. Oh, let's see. An effort. Okay, we got one more question and then I'll wrap things up here. So yeah, an effort to lift the ban on rent control or reshape limitation on rates of increases in rent. Anything on anyone's radar there? And if you don't want to answer that, I think I can.
I do know that the topic of discussion is oftentimes whether or not a particular bill does touch the issue of rent control. So it is a very protected, hard fought, and challenged concept. And I think that is one that, policymakers at every level of government, in particular the local level, really tries to navigate. So I don't have a good answer to that question, only to say that that's a litmus test for many bills that we do see, is whether or not it touches the issue of rent control ban.
Yeah, thank you for that. That's very well put, but much better than I could have stated it. So thank you for that, Representative Stonier. Okay, all right. I'm going to go ahead and return and start to wrap things up for tonight. So let me get all my screens situated here. Got a technology, all right, so back on track. Oh, see, there is everybody. Q&A. Okay, here we go. So I just, really, again, want to take a moment to sincerely thank all of our advocates who signed in to support and testify on legislation, who shared their stories underwent the emotional labor of sharing their experiences of eviction and homelessness. I know you all as legislators, oftentimes these meetings are very emotional. People, you know, it's a lot for people to talk to you about some of these things that have happened in their lives that are traumatic. And so I just want to, again, thank you all as well for providing that ear and, you know, tangible way for people to be involved in their government. You know, there has been so much loss due to the pandemic and so much advocacy as well. And so this last session altogether, lawmakers received thousands of emails from affordable housing advocates. Almost 500 individuals and organizations signed on to letters to lawmakers in support of our priorities across the state. 56 people testified on bills and committee hearings, which is a lot in a short 60-day session. Many hundreds of you signed in to register your support for key bills. And we did have another 100% virtual housing and homelessness advocacy day. And there were over 600 advocates who attended that. And Clark County advocates had appointments and meetings with all 9 legislators, which is phenomenal. So here are some ways that you can take action. As you've heard tonight from Cheryl and our lawmakers here, you know, our lawmakers are here for us. They're here, they want to hear from us. So don't be afraid to call or email them and discuss what is important to you. Like even tonight in the chat, bringing up things that they hadn't thought of before. They're very open-minded people. They're here to represent you. And if you haven't already, like Cheryl plugged earlier, please sign up for our action alerts and our e-newsletter at Council for the Homeless on our website. The links are there. And then you can, you know, as always, please just share what you've learned, share the data. We will be doing a webinar about our system numbers within the next couple of months. They're getting crunched right now. Share the facts, dispel the myths, and reduce the stigmas of homelessness. And remember that most of the people that you see experiencing homelessness are the people who are the most vulnerable and they're struggling the most. They have those mental health and behavioral health challenges. And for every one of them that you see, there are 4 others that go unseen. And we do this work for everyone because we know that by helping our unhoused neighbors, it benefits all of us. We're all in this together. And the solutions are complex and take time. And I also know that the results of investments made by our legislature, you know, even, you know, this year, the last couple of years before this, you know, it takes time, but it is coming. And, you know, as always, we end our webinars with be kind to those that you see living on the streets and in shelters and in cars. You never know just how far that kindness can go. And with that, I think I'll turn it back over to Senator Cleveland to share what you were going to share, and then we'll go ahead and wrap things up.
Thank you, Laura. I appreciate that. Well, I want to share a statement from the National Healthcare for the Homeless Council. And as I shared earlier tonight, this is a statement that I read on the Senate floor when we were considering Representative Chopp's Housing is Health bill. And the statement reads, "Human rights theory holds that all particular rights are universal, indivisible, and interdependent and interrelated. As Americans begin to pay more attention to human rights as the proper conceptual framework for our struggle to end homelessness, we are coming to understand the interdependence of human rights in very practical, not just theoretical terms. In particular, we are recognizing that housing is healthcare and that extension of both rights together is necessary for ending homelessness." So that is a statement that really moves me. And I think that my call to action tonight, or my ask of each of you participating, would be to just really help us all to spread and broaden that recognition that housing is health. So thank you, Lola.
Yeah, thank you so much. Representative Stonier or Harris, do you have anything to add?
I think my call to action is just to learn about something new and a little outside of your wheelhouse. I think we talked a lot about integration and implementation, and Senator Cleveland's quote kind of illustrates that quite well. And so for those that work in this policy area, I just encourage folks to maybe look at one of the other huge impacts of people impacted by the lack of affordable and available housing, and think about, what is your stretch goal, or your teachers are used to saying things like stretch goals. What can you think more deeply about and learn a little bit more about to help connect the dots for those of us who are in positions to help integrate those on a policy level. I'm working to do that myself. The last couple of years, I've made the commitment to some of the folks here in this room to learn more about the housing issues facing this community and how it's different in other parts of the state, so I can be a better advocate for what this community needs that's maybe a little bit different. And that's also true for childcare access. And there are 2 provisos in the budget this year that that can put to work some of the state resources because of what I've learned a little bit outside of my wheelhouse, some new learning that I've dug into. And I know I have a lot more to do as a result of that. So, I can learn a lot about things that I'm already knowledgeable about because that it fits better with what I already understand. It's harder to dig into something that's new and different. So I guess that's my call to action, is just to think about one of those areas that might be a stretch.
Maybe just in closing, I'd just like to say what a privilege it is. It's been an honor to serve our community. I think times are different in politics, and I just want to say thank you. I look at our community, it's not perfect, but the 3 of us have had a rare opportunity to build a waterfront that I think is absolutely beautiful in our community. We're going to have an opportunity to build a bridge that I think it'll make a huge difference to our community. And I just, we have some homeless individuals, and we're going to continue to work on that. We need to clean up our community a little, but I tell you, we are so fortunate. This is a blessed community. We've always stood up and done what's right, and I think we will continue to do that. And I've just been fortunate enough to work with Senator Cleveland and Monica, and we will continue to make our community better, and I'm really excited about that.
Yeah, thank you very much. And I just want to thank the 4 of you very much for your time tonight. Instead of being in person and getting to chat afterwards, I'm going to end this webinar, and it's going to be super awkward. So please just know how grateful I am for you tonight, and always actually for all of you. Cheryl, you come through for us, on the coldest of cold winter nights, just day in and day out, and with severe weather shelter, and your service to our board of directors. We're so grateful for that. Cheryl is in the trenches slogging away every winter to serve folks during the hardest months of the year, and even sometimes when we have heat waves and smoke events as well. So always just a phone call away, and I just appreciate it so much. And Senator Cleveland and Representative Stonier and Representative Harris, you all are just phenomenal, frankly, partners to work with, for our state and our community. And so thank you so much. And we'll get back at it again next year. So thank you, everybody.
Thank you, everyone.
Yeah, have a good night.